Moving on to the muscles of the extremities, let's start with the upper extremity and then move into the lower extremity. The biceps brachii is located on the upper arm. Biceps means it has two heads, and brachii refers to the region where it's located. The short head of biceps brachii originates from the coracoid process of the scapula, and the long head originates from a small tubercle just above the glenoid cavity of the scapula. This muscle inserts on the radius. Because this muscle crosses both the shoulder joint and the elbow joint, there are multiple movements possible with this muscle. When the biceps brachii contracts, it flexes the forearm at the elbow and the arm at the shoulder. As a side note, it's important to understand that the muscle only moves the bone at the joint it crosses, meaning if the muscle does not cross the shoulder joint, it will not move the arm. Likewise, if the muscle does not cross the elbow joint, it will not move the forearm. The brachialis muscle is on the anterior surface of the humerus and deep to the biceps brachii. It originates directly from the periosteum of the bone and inserts on the ulna. When this muscle contracts, it flexes the forearm. Brachioradialis is a larger lateral forearm muscle. Brachio because it originates in the brachial region, specifically the lateral epicondyle of the humerus, and radialis because it inserts on the radius near the styloid process. When this muscle contracts, it will flex the forearm. On the posterior part of the arm is triceps brachii. Triceps means three origins. It has a long head, a medial head, and a short head. The lateral head originates from the lateral aspect of the humerus. The medial head originates from the posterior part of the humerus, and the long head originates from the scapula below the glenoid cavity. Triceps brachii inserts on the olecranon process of the ulna. When it contracts, it extends the forearm, working as an antagonist to the anterior forearm muscles. Moving on to the muscles of the anterior thigh. Sartorius is the longest muscle of the body. It originates on the anterior superior iliac spine, crosses the thigh, and inserts on the medial tibia. When sartorius contracts, it will flex the femur, flex the leg, and laterally rotate the femur. This movement occurs when you cross your legs by putting your right foot on your left knee or vice versa. Gracilis is the most medial thigh muscle. This muscle originates on the pubis and it is inserted on the medial tibia. When it contracts, it adducts the femur and flexes the leg. The adductor longus originates from the pubic bone and inserts on the linea aspera of the femur. When it contracts, it adducts and flexes the thigh. Adductor magnus is a very large adductor muscle originating on the pubis and the ischial tuberosity of the ischium and inserts on the linea aspera. When this muscle contracts, it adducts and extends the thigh. The quadriceps consists of four different muscles. The rectus femoris is the anterior thigh muscle. This muscle originates from the anterior inferior iliac spine and inserts on the tibial tuberosity via the patellar ligament. Because this muscle crosses both the hip and knee joints, when it contracts, it can flex the thigh and extend the leg. Vastus lateralis is the lateral thigh muscle and originates from the greater trochanter of the femur and inserts on the tibial tuberosity via the patellar ligament. When it contracts, it extends the leg. Vastus medius is on the medial side and originates from the linea aspera of the femur and inserts on the tibial tuberosity via the patellar ligament. When this muscle contracts, it also extends the leg. The last muscle of this group is vastus intermedius, which is located deep to the rectus femoris. It originates from the anterior and lateral aspects of the femur and inserts on the tibial tuberosity via the patellar ligament. When this muscle contracts, it also extends the leg. On the anterior side of the leg is the tibialis anterior. This muscle originates from the lateral condyle and shaft of the tibia and inserts on the tarsal and metatarsals. When this muscle contracts, it dorsiflexes the foot. The pain associated with shin splints can be caused by a number of things. It can be small stress fractures of the tibia, inflammation of the periosteum surrounding the tibia, or tendinitis of the anterior leg. Now, let's turn our attention to the muscles on the posterior side of the lower extremity. The gluteus maximus is your butt muscle. It originates from portions of the ilium, sacrum, coccyx, and lumbodorsal fascia and inserts on the iliotibial tract and the femur. When it contracts, it extends and rotates the femur laterally. The gluteus medius, for the most part, is deep to the gluteus maximus. It originates from the ilium and inserts on the greater trochanter of the femur. When this muscle contracts, it's going to abduct and medially rotate the thigh. As a clinical note, this is a good site for intramuscular injections because it's a lot easier to get muscle tissue rather than the gluteus maximus. The gluteus maximus generally has varying amounts of fat covering it, making it harder to perform an intramuscular junction into this region. The next group of muscles are the hamstrings. There are 3 muscles that make up this group. The biceps femoris is on the lateral side and contains 2 heads. The long head originates from the ischial tuberosity, and the short head arises directly from the femur. This muscle inserts on the fibula and the tibia. When this muscle contracts, it flexes the leg. Semitendinosus is the muscle on the medial side and has a long, slender tendon. It originates from the ischial tuberosity and inserts on the medial side of the tibia. When this muscle contracts, it flexes the leg. The last muscle of this group is semimembranosus, which is a flat muscle on the medial side of the thigh. This muscle originates from the ischial tuberosity and inserts on the tibia near the medial condyle. When it contracts, it will also flex the leg. The last 2 muscles to talk about are gastrocnemius and soleus. These are the muscles of the calf region. Gastrocnemius has 2 heads, and they originate from the lateral and medial condyles of the femur and insert on the calcaneus by way of the Achilles tendon. When this muscle contracts, it will plantar flex and invert the foot. It can also flex the leg. Underneath gastrocnemius is soleus. Soleus is a flat muscle that resembles a type of flat fish. This muscle originates from the fibula and the tibia and does not cross the knee joint. It inserts on the calcaneus via the Achilles tendon. When this muscle contracts, it plantar flexes and inverts the foot just like gastrocnemius. This ends the chapter. You can use the learning objectives to create a study guide for yourself. Start learning the muscles now. Do a little bit each day, and before you know it, you will have learned all the ones we've covered. This chart at the end of your lecture guide is good practice for learning muscles. Try to complete it without your notes to see what you know.